Most people believe they know what a heart attack looks like. They imagine a person suddenly clutching their chest, collapsing, and being rushed to the hospital. That image has been repeated in movies and television for decades. But in real life, heart attacks often look very different. In fact, many heart attacks begin with symptoms that seem small, vague, or easy to dismiss. A little pressure in the chest, a strange fatigue that appears out of nowhere, mild discomfort in the jaw or shoulder, shortness of breath during a simple activity. Because these symptoms do not always feel dramatic, many people ignore them. They assume it is indigestion, or a pulled muscle, or stress. And sometimes those explanations are correct. But in other cases, those early symptoms are the body's way of signaling that the heart muscle is not receiving enough oxygen. That is exactly what happens during a heart attack. A heart attack occurs when blood flow through one of the coronary arteries becomes blocked. These arteries supply oxygen-rich blood to the heart muscle itself. If a blockage suddenly stops blood flow, the heart muscle begins to suffer from a lack of oxygen. The longer that blood flow remains blocked, the greater the damage to the heart muscle. This is why early recognition is so important. The sooner treatment begins, the more heart muscle can be saved. But here's the problem: many people delay seeking help because the early warning signs do not match the dramatic symptoms they expect. Today we are going to talk about the warning signs of a heart attack that people most often ignore, especially adults over the age of 60. Understanding these signs could one day save a life, possibly even your own. Let's start with the most well-known symptom: chest discomfort. When people imagine a heart attack, they often picture sudden, severe chest pain. But chest pain during a heart attack does not always feel sharp or intense. Many people describe it as pressure, tightness, or heaviness in the center of the chest. Some say it feels like someone is sitting on their chest. Others describe it as a squeezing sensation, and sometimes it feels surprisingly mild. Because of this, people may assume it is simply heartburn or muscle strain. One common pattern doctors see is chest discomfort that appears during physical activity and improves with rest. For example, someone may feel pressure while walking upstairs or carrying groceries. After resting for a few minutes, the discomfort fades. This can happen when the heart muscle is not receiving enough oxygen during exertion. It may represent angina, a warning sign that coronary arteries are narrowed. Ignoring this symptom can allow the problem to progress until a complete blockage occurs. Chest discomfort may also come and go. Some people experience episodes for hours or even days before a heart attack becomes severe. Because the discomfort is not constant, they assume it is harmless. But recurring chest pressure should never be ignored. Another warning sign that people frequently overlook is unusual fatigue. Fatigue may not sound like a heart attack symptom, but it can be one of the earliest changes the body experiences. Many patients later say something like this: "I just felt unusually tired for a few days. I couldn't explain it, but I had no energy." This type of fatigue often feels different from normal tiredness. It may appear suddenly without a clear reason. It may make simple activities feel exhausting. Walking across a room may feel harder than usual. Climbing stairs may leave you drained. Because fatigue is such a common feeling, people often dismiss it. But when fatigue appears suddenly and is accompanied by other symptoms, it deserves attention. Shortness of breath is another warning sign that people frequently underestimate. Some people experience shortness of breath without chest pain at all. They may simply feel that breathing becomes harder during activities that once felt easy. Walking across the room, getting dressed, or climbing stairs may suddenly feel exhausting. This can happen because the heart is struggling to pump blood effectively. When circulation becomes inefficient, fluid may build up in the lungs. This makes breathing more difficult. Shortness of breath that appears suddenly or worsens quickly should always be evaluated. Heart attack symptoms do not always stay in the chest. Pain or discomfort may spread to other areas of the body. One common location is the left arm, but pain may also appear in the right arm, shoulders, neck, jaw, or upper back. Some people feel aching between the shoulder blades. Others feel discomfort in the jaw that seems unrelated to the heart. Because these sensations occur outside the chest, they are often misinterpreted. A person may assume they slept in an awkward position or strained a muscle. But when pain spreads from the chest to the arm or jaw, it can be an important warning sign. Another symptom many people ignore is nausea or stomach discomfort. Some heart attacks begin with symptoms that resemble indigestion. People may feel queasy or develop an uncomfortable sensation in the upper abdomen. They may assume the problem is related to food or digestion. This is especially common among older adults and women. Unfortunately, this misunderstanding can delay medical attention. If nausea appears together with chest discomfort, fatigue, or shortness of breath, it should never be ignored. Cold sweats are another symptom people sometimes dismiss. Breaking into a sudden sweat without a clear reason, especially when resting, can be a warning sign. Many patients describe feeling clammy or unusually sweaty while also experiencing discomfort or weakness. This type of sweating is different from sweating during exercise or hot weather. It may feel sudden and unexplained. Lightheadedness or dizziness can also occur during a heart attack. If the heart is not pumping effectively, blood flow to the brain may decrease. This can cause dizziness, weakness, or even fainting. These symptoms can appear together with chest discomfort or shortness of breath. But sometimes dizziness is the first sign people notice. Because dizziness has many possible causes, people often assume it is harmless. But when dizziness appears with other symptoms, it should be evaluated. Heart attack symptoms can appear differently in women. While chest discomfort is still common, women are more likely to experience symptoms such as fatigue, nausea, shortness of breath, or back pain. Some women do not feel strong chest pain at all. Instead, they may feel pressure, unusual tiredness, or discomfort in the upper body. Because these symptoms do not match the classic image of a heart attack, they are often overlooked. That is why awareness is so important. It is also important to understand that heart attacks do not always happen suddenly. In many cases, the body sends warning signals hours or even days beforehand. A person may feel mild symptoms that come and go. They may notice fatigue, breathlessness, or occasional chest pressure. Because these symptoms are mild, they are often ignored. But these early signals can be the heart's way of asking for help. Recognizing them can allow treatment before serious damage occurs. If you experience symptoms that may indicate a heart attack, time matters. Medical treatment works best when it is given quickly. Restoring blood flow to the heart muscle as soon as possible can significantly reduce damage. Unfortunately, many people delay seeking help. They wait to see if symptoms improve. They assume the discomfort will pass, or they do not want to bother anyone. This delay can be dangerous. If you experience persistent chest pressure, discomfort spreading to the arm or jaw, shortness of breath, sudden sweating, nausea, or dizziness, it is important to seek medical attention immediately. Calling emergency services is often the safest choice. Emergency teams can begin treatment while transporting you to the hospital. Protecting your heart also involves reducing the risk factors that lead to heart attacks. High blood pressure, high cholesterol, diabetes, smoking, obesity, and lack of physical activity all increase the risk of coronary artery disease. Managing these factors can significantly reduce the chance of a heart attack. Regular physical activity strengthens the heart and improves circulation. Balanced nutrition supports healthy cholesterol levels. Managing stress and maintaining healthy sleep patterns also benefit heart health. Routine medical checkups allow doctors to detect risk factors early. Perhaps the most important message is this: never ignore changes in your body. Your body often provides early warnings before serious events occur. Chest discomfort, unexplained fatigue, breathlessness, nausea, sweating, and dizziness may seem like minor symptoms, but sometimes they are the heart's first signals that something is wrong. Recognizing those signals can make the difference between early treatment and delayed care. And when it comes to heart attacks, time truly matters. The sooner blood flow is restored, the more heart muscle can be saved. So if something feels unusual, especially if symptoms appear suddenly or together, do not ignore it. Your heart works for you every minute of your life. Listening to its warning signs is one of the most important ways to protect your health after 60, because sometimes the symptoms people ignore are the very ones that matter most.